Top stories in health. Measles outbreak and pain breakthrough. From a growing measles outbreak in Texas to a groundbreaking new pain treatment, here are this week's top stories in health. Let's get started. First up, a major measles outbreak in Texas is fueling a heated debate over vaccines. Doctors warn that declining vaccination rates are making preventable diseases a growing threat. At the same time, some parents are turning to vitamin-based immunity boosters, a viewpoint that aligns with Secretary Robert F. Kennedy Jr.'s long-standing advocacy for alternative health approaches. Public health officials continue to stress that vaccines remain the best defense against measles, which can lead to serious complications like pneumonia and brain swelling. With cases rising nationwide, experts warn that misinformation could make outbreaks even worse. That's not the only public health concern making headlines this week. Let's talk about daylight saving time. You know that feeling when you lose an hour of sleep? It's not just annoying, it could actually be dangerous. New research shows a strong link between daylight saving time and serious health risks, including higher rates of heart attacks, strokes, and workplace accidents. One study found that heart attacks spike by 24% on the Monday after the time change. The disruption to our sleep cycle can throw off stress hormones, blood pressure, and concentration levels. Some states are pushing to eliminate daylight saving time altogether, arguing that the risks outweigh any benefits. What do you think? Should we stop changing the clocks? Let us know in the comments. And while daylight saving time is under scrutiny, so is the federal health system. At the Department of Health and Human Services, big changes are happening. Under the leadership of Secretary Robert F. Kennedy Jr., HHS is offering employee buyouts at key agencies, including the CDC, NIH, and Medicaid offices. The goal? A leaner, more efficient system. But some public health experts worry that these buyouts could disrupt critical services. Federal programs like Medicaid, disease prevention, and pandemic response might see shifts in staffing and funding. While HHS insists essential services will continue, some analysts warn that these changes could have ripple effects across the system in the months ahead. Meanwhile, in the world of medical breakthroughs, researchers are making big strides in pain management. A new pain treatment could revolutionize how we manage chronic pain without opioids. Researchers funded by the NIH have developed a novel drug that targets pain pathways at the molecular level. The goal is to reduce chronic pain with fewer side effects than traditional painkillers. With opioid addiction still a major crisis, this could be a game changer for people suffering from conditions like arthritis, nerve pain, and post-surgical recovery. Early trials are showing promising results, but more testing is needed before it hits the market. And finally, let's talk about something many people are still struggling with: the long-term effects of COVID-19. 5 years after the pandemic began, millions of people are still dealing with lingering physical and mental health challenges. Long COVID symptoms like chronic fatigue, brain fog, breathing issues, and even heart complications continue to affect daily life. Mental health experts are also seeing a lasting increase in anxiety and depression tied to the pandemic's disruptions. Scientists are still working to understand the full impact and explore new treatment options. But for many, COVID-19's effects are far from over. That's it for today's top stories in health. If you want to stay updated on the latest in health, wellness, and medical breakthroughs, make sure to subscribe to Health Post 360 and tap the notification bell so you never miss an update. Which story stood out to you the most? Drop your thoughts in the comments. Want to read more? Visit healthpost360.com for full details.